begin as people are kind of coming in. All right, let me go back to sharing my screen. So thank you all for coming and joining us either live or on the replay to the Tongue Symposium. This is kind of like Jessica, me, and Leah, and Bryce. Is like this is all our passion, what we're going to be talking about this weekend. And what we really, really hope is that at the end of this, you're going to come away with a real understanding of some potential roadblocks that singers are up against today that we have really not yet been aware of in terms of the public consciousness. So this is truly a groundbreaking symposium for the vocal world. And I'm so thrilled that we all get to be here and present this to you. So just a couple of housekeeping notes for today. Okay, I made a little silly thing here, just some reminders. Okay, if you can, keep your mic muted. This really helps the replays, okay? Everybody's gonna thank you. If you keep your mic muted at all times, except there will be time for question and answers. So then we will be calling on you, and you can raise your hand, and you make sure that you raise your virtual hand when asking questions, because then we can call on you and you'll be spotlighted so that it will be good for the recordings. That really helps people watching the replay. And just make sure you keep the chat focused, because sometimes, you know, we're going to be asking questions and sort of finding out your experience, and it really helps if we can just keep the chat very focused to what we're talking about. If you want to send private messages to people, feel free. That is, I think that function is allowed on here. So, all right, I'm going to stop my screen share. Enough of this. Okay, so first of all, what I want to ask of you all today to start this out is I want you to just take a moment, be quiet, don't talk, and notice what your tongue is doing right at this moment. When you're quiet and at rest, where is your tongue? Notice all parts of your tongue. Okay, have you got that? Now I want you to write in the chat and tell us what you're noticing. Tell us where you feel your tongue sitting. Anything that you notice at all. There's no right or wrong answer. We just want to see this in the chat. Okay, on the roof of the mouth. Great. On the hard palate. Okay, good. Nice. Mine is pressed to the hard palate. Good, good. Oh, we've got lots of coming in here. Tip of the tongue just behind the upper teeth. Good. Tip and middle part of tongue are up on the palate. Posterior part is not. Okay. The surface of the tongue touching the hard palate. Back of tongue drifts downward. Pressed against my front teeth. Tongue rests on the roof of the mouth. Behind the lower teeth. Okay. Front is on the hard palate, just behind the teeth. Touching the alveolar ridge. Good. Okay. Down and back. Okay. Tip resting on top of upper teeth at rear. All right. So we've got kind of, oh, not at the roof of my mouth, not at the bottom, sort of sticking between my lips. Not comfortable, not sure why it's doing that. Okay, this is great, great. Mine tends to push down below the lower teeth. Okay, partially on the roof of the mouth and tip pressed to the lower teeth. Okay, tip on the roof of mouth. This is great, guys, thank you so much. Okay, touching the lower teeth, up on the palate, but kind of tilted to the left. That's interesting, okay. The tongue tip touches the back of the two front teeth. All right, great, thank you guys, thank you. And one more question, just for fun, okay, this is kind of a quick getting to know you. I'd love you to just type in the chat where you're calling in from, or where you're from, whichever one feels right in the moment. Texas, yes, I was born there. Okay, Rhode Island, Ithaca. Oh, wow, London, Greece, Burgos, Spain. Oh, Burgos is beautiful. Okay, Manchester, UK, Winston-Salem. Oh, love it. Dublin, beautiful. Berlin, all over the world. Spain, Napa County. Oh, I'm jealous. Who's from there? Okay. Istanbul, Turkey. Yes. All right. South Spain, Ontario, Portugal, Sweden, Hong Kong, in Thailand. Wow. Cool. Taiwan, Oklahoma, India, Orlando. Yes. Okay. France, Iceland, Bremen, Boston, Berlin, Geneva, the Netherlands. Wow. All over. Awesome. Awesome. Okay. That's fantastic. So we really do have a worldwide representation here. That is just fantastic. Okay. So we will be circling back to this question about your tongue a little bit later. But first, I'd like to introduce myself. Okay, some of you know me. My name is Julia Radosh, and I'm an operatic soprano and a voice teacher and owner of Voice with Julia. And maybe you've heard a little bit about my journey, but I want to tell you a little more today, especially as it relates to tongue restrictions. Okay, so I suppose you would have called me a natural singer. I had a nice tone, but early on I struggled with top notes when I was young. And by the time I went to college, I was finally able to sing high B's and C's, but it wasn't what I would call easy. I was quickly proclaimed a mezzo by my first college teacher, but I absolutely didn't agree with that, and so I switched studios. And my new teacher let me explore my own voice, and through play and experimentation, I discovered a completely new register of my voice, a free and released head tone that would sail up to high E's and F's. And so just in the spirit of safety, I declared myself a coloratura because I didn't want anyone to take away my high notes that I had finally found. So years went by and I improved significantly. I won competitions, got jobs, etc., blah, blah. Okay, but however, when I hit my late 20s, my voice changed quite drastically. And it was growing, it was getting richer, and everyone thought this was a good thing. And for a few years, I believed what they were saying, even though it didn't feel quite so good in my throat. Things were feeling harder, but everyone liked it. So I just kept doing that because I was getting positive feedback. So things kind of continued like this, kind of like an iceberg. You know, you only realize there's a huge problem when you see it above the water. And it was only when my top started becoming severely affected that I knew something was wrong. And so I took a step back. I didn't want to have input from anybody else because I knew that this was not about the sound. This was about the function. This was about what I was feeling, and nobody could figure that out except for me. So I researched, I tried different things, and eventually I discovered what I call public enemy number one, and that's the tongue. That's why we're all here, right? Okay, so my tongue, I discovered, was rock hard when I was singing. And I'm like, at this moment in time, things had gone on so far down this road. I thought, how on earth is my tongue rock hard when I'm singing? Like, this is something I care about, right? How did it get this way? So I got a little bit, you know, freaked out. Like, how did it get so far out of control? How could it be that I had been singing so well and freely for a really long amount of time, and now I wasn't, because it didn't make sense. My technique had changed. So after I kind of, you know, put everything together, instead of getting upset, I started training my tongue. I read studies and watched videos from Dr. Mike Mew, who I'm sure we'll hear about from Jessica a little bit later. I decided that I needed to correct my tongue posture, not just in singing, but in everyday life. And it was this single decision that changed everything. In addition to changing my resting tongue posture, I started doing tongue exercises, usually things I just made up, things to get my tongue moving and strong. And my singing started improving rapidly again. Things were easier than ever, and I was really happy. My top notes came back, and the voice still was the bigger instrument that I had kind of left off with, but it was much freer through this work that I was doing. However, one part of this story that I haven't shared yet was that I had this unexplained neck and shoulder tension that had been plaguing me for years. And it was so bad, I actually was hospitalized once for it, weirdly enough. literally passed out in an airport because I had such drastic neck tension that it just like made me see stars and I passed out. So it was bad, okay? And I knew something was off. And when I asked my parents if they felt aches and pains in their neck and shoulders, they said, no, not really. And I'm like, okay, they're in their 70s and they don't feel aches and pains. Like, I'm in my 30s, why am I feeling this? So I then wondered to myself, is what I'm feeling normal? So fast forward to last year, and I was introduced by a very wonderful soprano to the world of myofunctional therapy. And it was amazing to me that there was now a name for a lot of the things that I had been doing kind of intuitively on my own in regards to my tongue training. And I had no idea there was a whole world of this. So I got really excited and I invited my current myofunctional therapist to do an interview series in my group, Technique Talks on Facebook. And I sat through the presentation and I just kind of like, my eyes sort of got big as she went through her presentation. And I was like, oh my God, I have a tongue tie. And sure enough, after that interview, I asked her, I said, do I have a tongue tie? And she did a couple little tests and she's like, yeah, you absolutely do. And yeah, you have about a grade 2 tongue tie. And I was in shock. But finally, everything made sense after listening to her presentation and putting 2 and 2 together, the body aches, the unexplained tension, even I discovered my IBS symptoms. And I'm the type of person that when I hear something good, I act fast and immediately started working with my myofunctional therapist, scheduled the surgery and had it done within a couple of months. And I must admit that I originally did the surgery for body reasons, but now knowing what I know, I'm so glad that I made the decision for my voice as well. Because since having the surgery, certain things are just so much easier. Even at my top singing, I always felt a bit like I was walking a tightrope. Like my margin of error was just that much smaller than other singers. Like I had to have a much better game than other singers or else I wasn't going to be good. And that was scary to me because I felt like I couldn't let myself go like other singers could. And I might add that when I tried to let myself go in my younger years, things did not go well at all. So that's another thing. So now on the other side of surgery, I feel I have increased my margin of comfort by about 20%, and I've gained some really great benefits. And we'll be diving into these a little bit later during the symposium, exactly what these vocal changes were, and looking at the technical implications more closely. But for now, I can say that getting my tongue tie surgery combined with the myofunctional therapy that I had been doing unconsciously literally has changed my life and my singing. And my body feels so much more free. I sleep better. Singing is just easier. And the singers I have spoken to that have gone through this journey also feel similar. So I would love to now introduce my friend and fantastic colleague, Leah Stewart Hill. She is a wonderful soprano and voice teacher from Central Louisiana, and she's performed regularly through the US and Europe, as well as holding faculty positions at Mary Baldwin College and Pensacola Christian College. So I would love to invite Leah to take the stage and share her journey.
Thank you, Julia. I hope everyone can hear me okay. Maybe a thumbs up or something.
I think we have a little bit of feedback. Yes, now we're good.
Good? Okay, awesome, wonderful. Thank you, Julia. I am so honored to be here today. I'm so honored.
Leah, hold on. I think we have some tech difficulties.
Okay.
You might need to change the mic because it's a little bit cracking. Yeah. Okay. Let's give it a try now.
Okay. Is that any better?
No. Yeah. Oh yeah. Yeah, we think it might be your Wi-Fi. You know what we can do? we'll just switch this a little bit and we'll have Jessica come on and then we can have you jump in just a bit.
Okay, sounds good. Sounds good.
Okay, so we're going to switch the order just a little bit because there's a little bit of tech difficulties right now. So we're going to bring on Jessica Luffy, who is another fantastic soprano and colleague of mine. And Jessica also has the distinction of being the only combination of operatic soprano or operatic singer, actually, and orofacial myologist. So Jessica's going to come and give a presentation to us that's going to really shed some light on what we're talking about.
Do you want me to do the presentation or just do my story or both?
Yeah, why don't you do both?
Okay. Well, give me 1 second here. All right. Hi, I'm Jessica. I am so excited to be here and talk to all of you today. I am so passionate about what I do, both as a singer and an OM, an orofacial myologist. And so this marriage of things to me, I think I can say with a lot of confidence that this information could very much change your entire life and your entire career. And so I just feel so honored to share it all with you. So let's not waste any more time and get started. A little bit about me. Oh, why isn't it working? There we go. Sorry. A little bit about me. I started my early YAP career and my early professional career before I became an orofacial myologist. And so I started in, the traditional singers world. And I remember taking vocal ped in undergrad and just thinking, oh my gosh, this is amazing. I was immediately hooked. However, I always had this like underlying discomfort with the fact that we spent so much time on the larynx. And I just remember thinking to myself, why aren't we talking about the tongue? I don't know a single singer who doesn't have some sort of tongue tension or tongue issue. And it's literally a huge part of our instrument. Now, obviously, I was a little bit biased because I grew up in a dental family. My father is a general dentist, and so I came into it with a lot of this like pre-knowledge. And so as I went through my early career, I started noticing that certain singers with certain face shapes tended to have the same kind of technical issues. And then I took that a step further and I started looking in their mouths. And I started realizing that what their mouth shape looked like and their hard palate arch looked like ended up affecting their sound tone quality and their ease. And again, certain technical issues that they had. And I just thought, why don't singers why aren't they more interested in their mouths? Why aren't they going to the dentist? Why aren't they talking to their orthodontist? And so when I discovered or became aware of orofacial myology about 4 years ago, I felt like I finally found the holy grail of missing information that I had been looking for. And so I have been doing this ever since. So what I work on now, I work with both singers and with, normal people. And basically I come at it from a standpoint of functional movement and craniofacial or head symmetry and structure. And I also like to incorporate it into a full body postural alignment. And I also, like I said, have a lot of history with airway focused dentistry and sleep apnea, which is really big on the scene right now. So if you don't know what orofacial myology is, you're not alone. Basically, I consider myself part of one of two groups of people. So we have the medical professionals that work with the hard structures of the body, right? That's dentists, orthodontists, chiropractors. And then we also have people who work with the muscular or the postural or the functional side of the body. And that's the category that orofacial myology funnels under. We work with soft structures, tissues, tendons, that kind of thing. So let's break down what exactly it is. Mouth, face, myo means muscles, and ology is obviously the study of. Some of you may have heard this used interchangeably with myofunctional therapy. It's the exact same thing. People just have two different terms for it. So basically, what we work on is we work on strength, isolation, and posture as it pertains to the mouth and the face. So some of you may know, if you have a pretty heavy athletic background, that form follows function. That is, how you use your body affects what it looks like. It actually changes the hard structures in your body. So your muscles over time are stronger than bone because they're able to reshape them based on how you use them. So some of the health benefits that you and also my normal clientele can see: in 8-week program, you can have straighter teeth with no dental appliances. We also do a lot of work on asymmetrical facial structures and movement and function. The biggest thing that I see with my client adults is those that have sleep apnea and have TMJ. Not only can we improve those drastically, we can improve sleep apnea up to 50%, which is huge, but we also can totally eliminate TMJ, TMD, teeth grinding, jaw clenching. So, and I want to stress that we are attacking the actual cause of all of these issues. We're not putting a CPAP on you and just saying, okay, well, you have to wear this for the rest of your life. We're actually changing our bodies so that we can bring you back to that ideal structure and eliminate all of those health issues. And we also can get rid of body pain and tightness, like Julia was mentioning, in the back of her neck. That's very common. Also the front of the neck, shoulders. I even see clients that have a lot of hip flexor issues, even knee issues. Everything is so connected in our bodies, and that sense of tensegrity really does affect how we as human beings function. And even going as far as my child clients, I see huge changes in behavioral issues and ADD and ADHD because we're changing their airway itself. We're allowing them to breathe better both during the day and at night, and it's totally transforming their entire lives. So basically, the idea is we change your face, we change your life. So let's talk about face posture. A lot of us are familiar with the fact that, we all need good posture, right? And we're familiar with what it looks like in the body. So this is a gross oversimplification, but if you misuse your body, i.e., if you slump around all the time and you spend your whole life like that, then eventually, by the time you become like this older gentleman on the right, and all of those decades have gone by, well, now that man can literally not stand up straight. He cannot. His bones are now fused or shaped like that. Now, we can change him, we can make him better. But if we wanted to improve his posture, we would have to address his function. We would have to address his strength. We would have to reteach the muscles and the soft parts of his body to function in a more ideal way so that we can get him back into that ideal posture. Well, that's exactly what we do for the face, right? If you have a really great facial posture, then you'll age very nicely. But if we start with something and you have some hidden bad facial postures, then as all of that time goes by, we start to see a lot of face melting, or we see actual physical changes in jaw shape, in cheekbone shape, even in teeth. There may be a lot of you out there who have had orthodontics, you've had braces, and your teeth have changed over time, that's very common. It's not because your teeth are waking up in the middle of the night and scurrying around. It's because all of the muscles in your face and your tongue and your mouth are causing them very, very slowly to migrate over time. So let's be a little bit more specific. Let's talk about lip posture. Your lips should be closed at rest. If you're just sitting there reading a book, watching TV, your lips should be closed. You should not look like this, right? We don't want that open mouth posture, that mouth breather. If everyone has ever called you a mouth breather, we all know that that's not a compliment, right? Also, another joke I share with my little kids is I tell them, why don't you show me an impression of someone who's dumb? And what do? They go like this, right? Now, we do have a lot of attractive people in the industry that are able to get away with it, and we sort of allow this open mouth posture because we find it a little bit seductive, but that is absolutely still wrong, right? Your mouth is not for breathing. Your mouth is for eating. Your nose is for breathing. That's why it's on your face. So I tell all of my kids, why don't you, I'll make a bet with you. Name one animal that breathes out of its mouth. And the answer is, if you want to try in the chat, I'll give you a second. But one animal that breathes out of its mouth. Well, it's a trick question because the answer is 0. None of them. They breathe through their nose or they breathe through their blowhole, right? We all have a separate anatomical structure that causes for airway, right? Even fish, they breathe from their gills. Aha. So here's what you should look like. Your lips should be closed. That lip line where they come together should be perfectly perpendicular and straight across. So you should be like absolutely mathematically pristine and parallel. I'll show you this again for a second. And you will find that obviously not all of them, but a lot of models and a lot of people that we consider very attractive, they all fall into this really fabulous resting lip posture because that's what keeps our face looking great. Now, we talked about lip posture. That may seem a little bit, obvious to some of us, but I want to talk about something that I'm sure a lot of people have no idea about, which is tongue posture. So we have facial muscles and and lip muscles, but the tongue is an absolute keystone of our entire face and our head. It's also the only muscle in the entire body that's attached on one end, which makes it sort of like its entire own alien. But basically, what your tongue should be doing, this is what Julia sort of gave you like a little teaser about. Your tongue should not be down between your bottom teeth. Your tongue should be at rest up on the entire part of your hard palate. So a lot of people were saying that they have their tongue tip up at their hard palate. That is correct, but you should also have the entire top section of your tongue also against the hard and even back into the soft palate. I want you all to do we'll do a little experiment. Just stick your tongue straight out of your mouth. Take a finger, and I want you to poke very lightly on the back of your tongue like this. And then I want you to close your mouth and see if you can get that part of your tongue on the roof of your mouth. Some of us are probably like struggling right now. If this is really difficult for you to do, I can guarantee that your tongue is not in a good resting posture. So here's a picture of what it looks like from the front, that is this way. You can see that the entire portion of the tongue is up between the upper row of teeth, not sitting like a rug at the bottom of our mouths. And again, the reason this is so important is because if everything is down, right, just if you slump in your chair, if your tongue is slumping in your mouth, then it's not creating that really great, fabulous, reinforced structure that we want, and that keeps us in an ideal situation over time. So here's an example of one of my recent clients. This posture is called a cave hold. Some of you may be familiar with it, but basically it recreates what correct tongue posture should look like. And I want you to watch this video, and I want you to see or type in the chat if you think that this person has correct resting posture or not. So you can see that as she lifts her tongue up and I'm asking her to hold that position, the entire portion of the tongue is vibrating and twitching, right? And you see the tip fall, and then you see the back of the tongue fall, and then you see the middle part of the tongue fall. So this tells us that she is spending absolutely no time in that correct tongue posture because she can't even hold it for 3 seconds. So as she goes out into her daily life, she is not recreating any part of that because she has absolutely no strength to do it. So let's talk about why this is so important for singers. So in this not quite exactly accurate model on the left here, we have a depiction of the tongue and the vowels, right? And I want you all to just take a second and notice how lifted the tongue is, even on that ah vowel, right? We all know a lot of us struggle with Italian ahs, right? And we all know that our tongue should not just be like a rug in our mouth, right? That even on all of those open vowels, we need arch in the tongue, particularly in the back. So if we just made a really, really simple list of all the things that singers need and want, we would need the tongue positioned high and forward in the mouth, right? That is lifted in the back and the middle. And we want the tongue, we want the tip nice and relaxed, floated on the bottom portion of our teeth. We don't want it to pull backwards into the pharynx, right? Like this. We don't want that. We just want it nice and high and resting in the front. We also want to keep all of that while lifting the soft palate in the back. And we want to be able, from that position, to isolate with specificity through different vowels, through different consonants, and even through vowel modifications, depending on if we need to move through different resonance pockets and passaggi. And last but not least, we want to be able to do all of those things with freedom and ease. So, do you guys think that it would be easier to create this ideal singer's starting position from here or from here? I think we can all see that it would be this one, right? An analogy that I give everyone, well, is it easier to float a feather downwards, or is it easier to push a boulder up a hill, right? So that video that we watched of that client with her tongue shaking, there is no way that she's going to give me nice, clean, isolated vowels if she can't even hold one position for 3 seconds, because staying up in that posture requires a baseline level of strength. And if we don't have that, then everything is going to be so much harder for us right off the bat. So here's another video of another client of mine. I'm going to have him do an exercise, and I want you to notice how twitchy he is. He is really trying, isn't he? He's trying really hard. So I want us to notice one more detail about this, which is that isolation requires strength. Again, those of us that have a little bit more of an athletic background, we know that body compensations happen as a result of the body looking for more stability or more strength, right? Because we compensate because our body is trying to add another group of muscles so that we can complete the function. If we go to pick something up and we don't have enough strength in our glutes and our quads, well, then our body goes, oh, we need more. So let's add in the lower back and the glutes and the quads. Let's add in the upper back and the glutes and the quads and the lower back, right? And so what the body is doing is that it's adding more and more and more until we cross the threshold of being able to do the action, right? So if we want to be able to find all of these very specific my brain shut down. Very specific formations, then we have to have a lot more strength if we want it to be completely isolated. So I want us all to watch this video one more time, and I'll talk you through it a little bit, but I want you to notice how many compensations this gentleman is using just from trying to do one exercise. Okay, so you see the lips tense. You can also see his nose tensing and his upper cheeks, right? Right? Okay, so now he's going to try to cheat by biting his tongue so it can't move. So now he's using his jaw, right? So just in the span of 3 seconds, he's using at least 4 different groups of muscles that have absolutely no control over the tongue, right? His body's just grasping for things to try to use because he doesn't have enough baseline stability. So, correct tongue posture. What's it going to give us? It's going to give us a much, much better starting position for us as singers, right? And it's also going to give us more strength because we already have a much improved baseline. And not only that, but because we have a better strength, we're going to get even better isolation because, again, we have that higher baseline. And I don't have time to talk about this today, but I just wanted to throw a little teaser in there for you. You can watch some of my other lectures online. But if you have correct tongue posture, we're also going to get an increased pharyngeal size and an increased nasal cavity size because we're recreating and improving that internal bone structure of the face and body. So if you're curious about that, you can find that on my website. Okay, so we're going to do an exercise on tongue strength. I recommend that you all, excuse me, I recommend that you all turn your cameras on so that you can watch yourself. That way you can use it like a little mirror. It might be easier for you. So I'll show you what we're going to do. We're going to do the one that that gentleman just did. Take one hand, lightly rest it on your chin. Open your mouth as far as you can, like this. And then I want you to just stick your tongue straight out of your mouth, like so. And you should be able to just hold it without clenching the jaw, without using the lips, without biting the tongue, without having the tongue rest on the lower teeth like this. That's not lifted, that's cheating, right? It should be like a surfboard straight out of your mouth. Ah. Your tip should be pointed and not like a dog tongue, right? So how many of you passed that test? All right. Does anyone have any questions about any part of that thus far? Oh yeah, some people, yeah, you might not even be able to extend your tongue from your mouth. That's very common. If you can't do this, if it doesn't extend outwards, that's common too. We're going to talk about that in 1 second. It feels tense. Points down.
Hey,
Any
Jessica,
exercise to train this.
I want Robbie to come on and just describe what he means, because I think this is going to be valuable information. Robbie, do you mind unmuting yourself and explaining your comment where you said
Hi.
I can stick it? Yes, there you go.
Yeah, so I can stick it. I actually had a tongue tie cut already. So that's part of the reason I, kind of
Great.
saw this. However, though, I guess I wasn't sure it was done correctly because I still kind of run into some problems. So I can just demonstrate, I guess. I can like stick it out, but there's kind of like a divot in the middle, like it doesn't go straight. Oh,
Can you show us?
oh geez. Wow. So I'll just try. Wait, okay.
Great.
Uh,
Yes. Do we all see how his tongue forms a cup?
mhm, mhm.
Uh-huh. Yes. That is fabulous. Okay, I want you all to like put a pin in that because we're going to talk about that in like 2 seconds. So that is the absolute perfect segue. Thank you. Mine does that too. Okay, Paula. Well, we're going to talk about you too in a second. Great. Thank you. Does anyone else have any other questions about posture or function or the resting position before we move on? If not, that's fine.
Jessica, there was a question about a palate, uneven palate.
An uneven palate. So if the palate in the mouth is tilted, again, that's functioning as the palate is part of the face, right? Everything's all together. So if your palate is tilted, I'm guessing that that whole side of your face is also a little bit asymmetric. Everyone has a little bit of asymmetry. That's normal. However, the palate tilt is really common. If you take two fingers and you stick them in your ears like this, your ears might be uneven as well. And that's a result of that entire internal structure gravitating on an axis. Just like our bodies, if we always wear our purse on our right side, or we always wear our backpack on our right side, what's going to happen over time? This, right? That's exactly what's happening inside your face. Tori's on the palate to correct tongue posture. Yes, that's a very dental question. I love it. Tori are very common with those that have tongue dysfunction. We also can't reverse them, but we can halt their growth by improving strength and posture. Fabulous question. Could the larynx being at rest be indicated of proper tongue posture? Yes, Robbie, you keep stealing all of my ideas. Yes, you're exactly right. We're going to talk about that one too. That's a great question. How can we reach the right tongue resting posture? Thank you so much for that question. There may be some of you out there who literally cannot get correct tongue posture, even with your teeth together. We are going to change your freaking lives, and I can't wait. So, with your permission, I will move on and address all of those issues right now. Just a quick note for Julia. You can't see my chat, can you? Is it in your way?
No, we can't.
Okay.
You're good.
Okay. All right. Thank you all. All right. So let's talk about the tongue tie. If you haven't heard of this, that's okay. We're going to give you the entire encyclopedia article on it. This thing is totally going to change your life. So, what is it? Well, a tongue tie is a type of connective tissue. It's found underneath the tongue and it's very tight. And basically, what it does is that it restricts the movement and the function of the tongue. Here's a couple pictures of what it looks like. And you can see it's that white, thin membrane, that line, it can, like on the left, extend all the way to the tongue and past the tip of the tongue. A lot of us are familiar with that with people with lisps, right? We know of a tongue tie when people have a lisp, but it's actually much more than that. So this person on the right also has a tongue tie. It's a little bit harder to see, but we still get that whole white vertical line, right? And it looks like it attaches about the middle of the tongue, yes? So how is a tongue tie created, I guess? Well, it starts at the base of the tongue where the tongue meets the floor of the mouth. And depending on the person, it extends upwards either to the middle or even all the way to the tip of the tongue. It depends on the person. You can have it show up in different ways, anywhere from the back all the way up to the tip. It also can be more restrictive or less restrictive depending on the person. Some people, it's very short, just near the base of the tongue, but it's very tight. Some people have it extend all the way up to the tip of the tongue and it has a little bit more freedom. It just depends. They're like different kinds of bungee cords. Some of them are stretchier and some of them are just like rope and they don't go anywhere. So again, when we think of tongue ties, we think of things that we can see, right? So if somebody showed up, I mean, this is an infant, but if somebody showed up in your studio on the left, you would be like, oh yeah, you have a tongue tie, right? That one's nice and easy. What about this person on the right? If you saw them as your student, would you think that they have a tongue tie? Because they absolutely do, but he's a little bit more hidden, should we say. Well, there's actually some that you cannot see at all. We hidden tongue ties, or ones that don't show any sign. They tend to be very common in mid-tongue and posterior restrictions. They look like this. So, that little middle line of his tongue, it's pretty pink, right? We don't look at that and say, oh my gosh, you have a lisp, you have this, you can't eat, whatever. No, that looks totally normal, right? And like, yeah, his tongue looks a little bit short and a little bit wide, but it doesn't look like there's really any issue there, right? He's able to lift it. It looks like he's getting a fair amount of function. Okay, well, let's give him a frenectomy and see what happens. Okay, so now we're seeing that his function is completely doubled, right? Now he's closing off that entire space at the roof of his mouth, and the mid portion and the back of the tongue is also lifting, right? So we can see afterwards how much range of motion and function this person is having from their frenectomy, because it's totally different from where we started, right? So I just want to reiterate that these aren't things that we can just look at and see. We have to address them functionally. That is, we have to see them move and watch their strength to see if they have something that we might not be able to see. So let's talk about this a little bit more anatomically. So if we have a tie that's fairly short and it's located right at the base of the tongue, it seems pretty harmless, right? Oh, it's just short, it's at the bottom, it's not really affecting anything, right? Wrong, because what this is going to do is it's going to affect the entire posterior section of your tongue, which, is kind of important for singers, right? Just a little bit. So that entire section is going to be either restricted movement, or in some extreme cases might not have any movement or isolation at all. Now, if the tie extends up even further, well, now it's going to restrict that entire back portion and the mid portion of the tongue. So now we're not able to lift the back or the middle. And then if it extends all the way to the tip, well, guess what? Your entire tongue is not going to function and move the way that it should freely. So again, there's varying degrees. You can have a really tight frenum or you can have a more loose one. But what I want to demonstrate is that any sort of tie is still going to restrict you. It doesn't matter where it is. It doesn't matter how long it is. You're going to have a lot of compensations and bad results from those. So let's go into that a little bit deeper. Let's say that you have a short, tight frenum that's causing a posterior restriction. Basically, that's going to prohibit you from correct tongue posture, right? Because you're not going to be able to lift that back section of your tongue up on your hard and soft palate. You're also not going to be able to swallow correctly. A correct swallow requires a correct tongue posture. And then you're not going to be able to elevate that portion of the tongue. And you're also, drum roll, not going to be able to get an elevation of the soft palate because, as we may know, the palatoglossus is connected to the back of the tongue, right? So if you want to lift it, you have to lift the back of your tongue. Well, if you can't lift the back of your tongue, guess what? Your soft palate isn't going anywhere, right? So you may be able to lift it a little bit if your frenum is a little bit looser, but you're still not going to be able to lift it as much as you could as if you were totally free, right? And also really important, if you can't elevate the tongue without any laryngeal or jaw motion, because you're going to be tied into that predetermined position. So if you go to, let's say, sing an E vowel, and you attempt to stretch and elevate the back of the tongue upwards, you're not going to be able to do that because of your tie. So what happens is now that whole portion becomes a predetermined set of space. So you have to choose between lifting your tongue or keeping your larynx low. So I use a metaphor like an elevator, right? So if you go to lift the back portion of your tongue, guess what? Your larynx is going to come with it and your jaw. Okay, well, if you want to keep a low larynx and a nice open jaw, let's say you're singing a high note, right? You need a lot of space. Well, guess what? That tongue is not going to lift. It's not going anywhere, right? So now you're stuck between a rock and a hard place. You have to choose. Do I want a high tongue with a lot of jaw tension, or do I want a nice low relaxed larynx, but I have to sing everything on an O vowel? You know, that's not really going to work out so well. So here's some of the things that I see and hear with singers that have a posterior restriction. This is just general. They really, really struggle with E and E vowels because that requires a really high back of the tongue. They also cannot do NGs, especially if they're going to ascend in the top section of their voice, right? They have a lot of trouble with high note phonation. Like I just described, that elevator is really going to restrict you, right? And they also tend to use or prefer a lot of open vowels, right? Because all of those open vowels, you can more or less allow that tongue to just lay there like a carpet, and that gives them a release of tension that they're looking for. So I want us all to do a little experiment real quick. We're going to take 2 or 3 fingers and put them on your jaw, and I want you to open as wide as you can, you know, gently. And then I want you to make an NG noise without moving your jaw. Right? A lot of you might not be able to do that. Now, if you can, let's take it one step further. Let's go back into that same position. You should be able to sing an entire siren to the entire top of your range and back down without having to move your jaw. Yes? And if you're feeling like something's happening down there, what you're experiencing is that elevator, that fight against lift. Yes? All right, well, let's say that it extends past, right? So now let's say your frenum is a little bit longer and it goes into the mid tongue, right? So now it's going to affect this entire mid portion. So again, you're not going to be able to get good tongue posture. You're not going to be able to get a correct swallow, but now you're also not going to be able to elevate the middle of the tongue. I also see a lot of clients that have trouble extending the tongue out of the mouth. Paula, I think that was you, right? And you're not going to be able to get that elevation of the mid-tongue separate, again, from the jaw and larynx. I notice it especially in the jaw with my clients. Singers with these tend to struggle with these vowels and these sounds, especially that nya, 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 because it's just that middle portion of the tongue, right? I also notice that these singers tend to bottom out in their lower range, especially if they've been singing for a long amount of time. And what they're experiencing is as they try to lift, that mid portion is tugging on their larynx and it's fatiguing them. They also tend to struggle with their bottom of their passaggio, because that's when we really need a lot of that mask resonance, right? That's when we really have to drive everything forward. So we want the back of the tongue and the mid part of the tongue forward. And that's when they really, really struggle to get into that mask placement. So not only do you have all of that, but guess what? You also have all of the posterior symptoms. Oh no, oh no, right? Okay, well, I'm sorry, but it doesn't end there, because let's say that your freedom goes all the way to the tip of your tongue. So now your entire tongue is not able to function correctly. So guess what? You're not going to have good tongue posture. You're not going to have a correct swallow. And also you're going to have little to no tongue mobility, strength, or isolation. Your articulation is certainly going to suffer, right? And again, you're going to have a lot of issues. Tongue tip clients have a lot of issues with jaw tension. And they tend to have a lot of stress in the front part of their necks, whereas mid and posterior tend to have stress in the back of their necks. You'll see these people have a lot of stress in the front. They struggle with all of these sounds, right? Everything that requires that tip lift. L's, D's, T's, and even S's, right? Now they may be, I'm not saying that you're automatically going to have a lisp. What I'm saying is that, let's say that you're a baritone and you're singing a patter aria and you just cannot get all of those consonants at a fast tempo. Well, maybe we should see what's under your tongue, right? Maybe you're having a restriction that's allowing you to flutter really quickly, right? I also find that these people have trouble really funneling and focusing the sound, especially on closed vowels in the middle voice or the lower middle voice when we want to be really, really nice and forward on our teeth. Also, almost that like musical theater brassy sound. They have a lot of trouble with that. And guess what? That's including all of the mid-tongue issues and all of the posterior restriction issues, right? So this is like a huge deal. So the moment we've all been waiting for. Let's do an exercise to see if you could be tongue-tied. I'm going to give you two. We're going to test your tip and mid portion restriction first. And if you pass that test, then we're going to test for your posterior restriction. So we're going to take the tip of our tongue and we're going to place it right behind our top two teeth like this. And then I want you to gently open your mouth as far as you can without moving the tip of your tongue from that spot. It should look like this. Now, holding that position, you should be able to fit 3 whole fingers between your teeth with ease, like so. If you have 2.5 or 2 or even 1, guess what? That tie is all the way up into at least the middle, if not the tip of your tongue, and it's restricting that upper movement. So if you all would like to share, can you just write in the chat real quick, how many of you failed that test? Now, for all of you who did pass the test, well, you passed one of them. We're going to do another one for a second. I'm trying to get my chat back up 1 second.
Jessica,
Oh, yep.
I want to bring up an important point. Somebody just said, what if my tongue is short? Can we talk about the short tongue thing a little bit?
Short. If my
Yes.
tongue is short.
I think what is inferred is that the reason why you can't open is because the tongue is short. Or at least that's the thought behind it. Mm-hmm.
Well, I think that you probably have one of those hidden ties, right? I mean, everyone's tongue is shaped a little bit differently, but the point of these exercises is that everyone should be able to do them, right? This isn't like gym class where some people are better runners than other. No, this is baseline function. If you cannot do that exercise and get 3 fingers, I mean, it's not a shape issue, it's a function issue. You are restricted, right? So my tongue, for example, is wider than most people's, and it's a little bit larger, but I'm still able to fit through that exercise. All of us should be able to. I hope that answers your question. Failed. 2.75, is that a tongue tie? Well, Susan, we're gonna find out. I'll let you scrape by into the second exercise because I'm curious to see if you pass the second one. So, can barely
Jessica, I just want to point out, Sarah actually, we know Sarah has a tongue tie, and Sarah says she could pass the test though. So is there a little bit something that, Sarah, I think you have a posterior tie, is that correct? I forget what the actual diagnosis was, but if you want to come unmute yourself, and you
Yes.
don't have to, but oh yes.
Yes, I
There you go.
have a tongue tie, a posterior tongue tie.
Yeah.
And so that I can, if I keep the floor of the mouth down, then I cannot touch the upper teeth at all.
Well, like I said, everybody who passed this test, you only passed the first round. We're going to do another one real quick. So I'm curious to see if you pass this second one, because now we're going to test our posterior restriction, right? So I'm going to have us do the one that I just showed you, that NG noise. So you're going to take 3 fingers, you're going to rest them gently on your chin. You're going to open as far as you can. Now from there, you should be able to make an NG noise without moving your jaw at all. You should have absolutely no tension here and no tension here. Right? How many people failed that test? Pass. Nice. Uncomfortable. If it's uncomfortable, then guess what? You're getting that elevator involvement, right? If you can do this one and not the first one, then that means that you have a frontal restriction, right? All right, let's go back to our, sorry. Oh, if you can't open the jaw all the way without tension, then you have TMJ, right? Temporal mandibular joint, right? That's tension here. If you can't roll your R's, that might be a tongue tie and a strength issue. Angela, you might have to see which one of those tongue tie passes you passed, right? All right, let's do another tongue posture exercise. I'm going to teach you the cave hold. Anyone who has ever done orofacial knows the infamous cave hold. So basically what we're doing is we're just recreating what correct tongue posture feels like. So for the sake of simplicity, this isn't exactly correct, but it'll be a little bit faster. I want you to take the tip of your tongue and to rest it on your dental ridge, the back of your dental ridge on your gum. It should not be touching your top front teeth. It should be just behind there. And then I want you to lay the entire top portion of your tongue up against your hard palate and soft palate. So it should look like this. You can see how I have space all the way to the back of my tongue, all the way back by my molars. Yeah. Now, if you hold that position, again, you should be able to get 3 fingers from that position, right? How many of you? Nope. Yeah. Nope. Here they all come. Nope, nope,
You know,
nope,
Jessica, on this one, I noticed on this one, Jessica, that the first one, like, I could fit 3 fingers, but on this one, I can fit like them in even more. So I
Oh,
wonder if
nice.
some people have that experience as well.
It's not comfortable, right? You can just do it. Okay, so if you can just do it, that's your body's already starting to incorporate some of that compensation, right? So you might have one of those ties that's a little more lax, like a bungee cord as opposed to a rope. But what's happening is that your whole neck goes like this, right? So that's not freedom and ease, right? That's compensation. Please demo again. Okay, yes, sorry. I have a cramp. Aha, if you have a cramp, that means that your muscles are not used to being up there, right? Just like when you get a cramp at the gym, it's like, ah, what is this? Not sure if the whole tongue is on the roof. Okay, we can do this exercise again where you stick it out and you just tap it, or you can tap your soft palate so you get a little bit of kinesthetic feedback to see if you are touching that spot. It might help you to swallow into that position. Got a cramp? Yeah. Only 2. Okay, so that's not bad, Diana, right? But ideally we want 3, right? The last one was the worst. Yeah. Okay, so some of us passed. No way, my neck is crazy tight. Okay, Maria, you said I passed the other ones, but not this one. Okay, so what is that telling us, right? That's telling us that you don't have the tip tie and you don't have the midline restriction, but that you are getting a posterior restriction, right? Like that first little diagram I showed, just right here at the base. Fabulous. Thank you all so much for that. Yes, Cecilia, you do need a slight suction to do this. Even short people should be able to do that. Yes. Yes, because your tongue is still what's that mathematical term? Oh my gosh. It's still to scale, right? Our bodies are still to scale, right? So just because you have a bigger face doesn't mean that you should be able to do them, right? Everyone should be able to pass all of these tests. Fabulous. All right, I'm gonna thank you all so much for sharing. I'm gonna move on just so that we make sure that we have enough time because we still have to talk about lip ties. Oh no. So we talked about tongue posture and we talked about lip posture, but we haven't talked about lip ties. So these are the exact same thing like tongue ties. They're a bit of connective tissue that connects the upper, the lower lip, or even sometimes the sides of the cheeks to the upper or lower gums, right? They can be just like frenums, like tongue frenums, they can be really tight, they can be a little bit more loose, they can be long, they can be thick. There's all different kinds of combinations. The upper tie in the middle of your Cupid's bow is the most common for everybody. And then after that, the lower bottom one, and then sometimes people have some on the sides of their mouth, but the one in the middle is the most common. And what this does is just like your tongue, it prevents it from getting a full range of motion and being able to completely separate, right? So here's a couple of photos of what they look like before and after. So I want you to take a look at this woman. She's doing a nice little kissy face, and I want you to notice how far her lips are extending out of her face. In fact, they're actually passing her nose. It's past the tip of her nose, right? That really fabulous kissy face, right? That's what we want. We want that really large range of free motion, right? So let's take a look at another guy. Okay, so it looks like his lips are extending, right? You can see a little bit of space, like it looks like there's a little curve there, right? But if we investigate this further, what we see is that he is totally cheating, right? He's thrusting both his neck forward and lifting his chin up. So if we fix that, here's what he looks like now, right? Okay, well, now it doesn't really look like he's getting a good range of motion, right? In fact, he's not extending at all. Look at that little bottom lip. It's like 1 millimeter, right? And that upper lip isn't even moving at all. Look at it. He's just tensing it, but it's not actually getting any motion in it, right? Not compared to this lovely lady, right? So what's happening is that that tie in his upper lip is prohibiting his lips from moving outwards into that kissy face, right? Just like his bottom lip too, right? I mean, he's kissing like this. His little teeny tiny lips, right? So we as singers all know that we, kind of need our lips, right? We definitely need them for certain vowels, as we all know, like ooh, no, right? Duh. But the other thing is that our lips affect our tone color throughout our entire range, right? If I'm assuming most of us are classical singers, right? And even if we're not, most of us know that that MT sound is real nice and wide and brassy, right? And the classical operatic sound is a lot more relaxed and forward and rounded, right? The round is from the lips, of course. Now, not only that, but these lips are really going to have a huge effect on all of our compensatory patterns. You remember the gentleman I was showing you his video and how he could move in his lips to try to move his tongue? Well, singers do that too, right? You'll see them tense their face while they're trying to get a specific position, right? So again, these ties are restricting isolation because they're just mashing everything together. They're also affecting cheek mobility, which we'll talk about in 1 second. And I've noticed in my own personal studio that especially that upper lip tie really has a huge effect on singers being able to find resonance pockets and placements, especially in the front part of their face, especially in this masky area, right? If we're trying to get forward and we're singing like this, we're going to have a little bit of issue. So let's do an experiment. We're going to, I want you to take one finger and I want you to very gently press on that Cupid's bow of your upper lip. And then I just want you to close your teeth and make a fish face. That doesn't feel good, does it? Right? How many of you share in the chat are already feeling restriction, right? Right? So, all right, let's take it one step further. Because we don't sing like this with our teeth closed. So let's put it back. And now I want you to let's pretend that you're going to sing, something in your upper passaggio. So you need a nice cheeky lift, right? So let's do a nice breath inhale in that position, right? You might start to feel this portion of your cheek fighting and antagonizing against this upper lip, right? Right? And you might start to feel this lower jaw start to get involved because it's not able to float on inhale, right? Okay, well, let's take it one step further. Now I want you to pretend that you're going to onset a high note. So again, here, nice cheeky lift, and you're going to give yourself a lot of space. Now what do you feel? I feel a lot of jaw tension, a lot of cheek tension, right? And I even notice, some of you may, that my tongue is a little tense. Does anyone feel tongue tension when they do that? I'm just curious. Cheek tension. Yes, tongue tension. I thought so. Yeah, Feeling all the tension. Yes, right. So, something like our lips seems sort of like an afterthought for our technique, right? But just this one little experiment, we can see that it's not, right? How many of you have had a knee injury or a shoulder injury or a hand injury? And then, it doesn't get fixed right away. Maybe you're on crutches or something. And by the end of the first or second week, now your other knee's hurting. Now your other shoulder's hurting. That's exactly what's happening here, right? Your lip is not independent of the rest of your face. They all work together, right? So if you're having trouble with one, I can guarantee you it's affecting something else. Yes? All right, so let's do a really easy experiment. These ones are nice and easy because they do just function solely on if you can see them or not. So these are nice and easy. You're just going to take 2 fingers like a little crab. You're gently going to pinch either side of your Cupid's bow. You can turn your video on and use it like a little mirror, and you're just going to lift your upper lip, and you're going to see if you have a little sail, like a sailboat in there. And then let me know what you find. You also might want to check your bottom, and you also might want to check the size of your cheeks up here. Yes, 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 tongue and lips. Yes, thank you, patients. I want to say that that is very common. If you have a tongue tie, any kind of tongue tie, your chances for a lip tie skyrocket, right? It's very unusual for us to have no tongue tie and a lip tie. So you're normal. Are we not supposed to have a lip tie? No, we are not. We are not. But again, you know, like I said with these statistics, right? We're not supposed to have tongue ties, and yet 75% of people have some sort of tongue tie. It's the same thing like lip ties. We're not supposed to have them, and so many of us do. Great. Now, all of these people that are telling me that you have a really, really thick lip tie, can you just shoot in the chat real quick? I'm curious how many of you struggle with rounded closed vowels, especially on the top part of your range where you need a little bit more space, and or if any of you had a lot of jaw compensation, right? Or a lot of cheek issue. Oh my God, yes, 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 yes. Uh-huh. Uh-huh. Now that all makes sense. Always struggled on those vowels. Isn't that interesting? What do you mean by a sail? Oh, I just mean that that frenum sometimes looks like a little triangle shape, right? Like those pictures I showed before. That's all I mean. Trouble with ooh. Yeah, ooh is a tricky one because we need both a high back tongue, a high middle tongue, and a rounded lips. So that's like the trifecta problem vowel for people that have ties. Nathan, just because you see the frenum does not mean you have the tie. Oh, if it's lip ties, yes. If you see it, you have it. If it's tongue ties, it has to be functionally assessed. Great. Yes, there should be no flesh there at all. It should be absolutely straight all the way across. Thank you all so much for those questions.
Jessica, I think something to maybe speak to is that there is a little bit of discrepancy in the medical community about lip ties and seeing them. I think that's where the confusion is. So maybe you want to speak to that a little bit.
Yes, thank you so much. Yes, even amongst doctors that specialize in frenectomies, there's sort of 2 schools of thought when it comes to lip ties. A lot of people say that if you have a lip tie, but you get a lot of motion, that you shouldn't necessarily get it released. I actually, in my personal story, I did not get my lip ties released when I got my tongue released. My doctor at the time talked me out of it because I wasn't an OM yet. And then about a year and a half ago, I finally decided to go get my lips released, even though I was considered mild. And this is just my personal opinion, but I noticed an immediate difference. I noticed an immediate difference in both the function and the like less stress in the cheeks and even the jaw, which was shocking to me. I also struggled on ooh vowels, right? And especially on keeping this nice tall position as I ascended. So I noticed a huge difference in lip ties. So yes, all of us medical professionals don't necessarily agree on that, but I think just from this one exercise and just from your own experience, we can all see that that one little thing, especially in singers, is going to have a huge impact on us, right? So that's all I have for now. If you guys have any more questions, we can answer a few more real quick in the chat. I just wanted to give you some of my information. That's my personal email address down there on the right. I love questions. So if you have any questions that you want to ask me, please feel free to reach out. I also always do free consults for everybody. So if you want to chat or you want me to take a look at you, you can go ahead and sign up on my website. Also Instagram, Facebook, all that good news. So maybe just a couple, like 2 or 3 minutes of any more questions.
I think some people, Sharam has his hand up, so maybe we can have Sharam come.
Yeah, let's do a vocal one.
Sharam, I think you have to unmute yourself.
Oh, yes. Hey, dears. Thank you so very much for all great informations. Do you hear me? Yeah, amazing. So as all we know, all great singers like Birgit Nilsson, like the Mario del Monaco, Franco Corelli, they all believed and they said, while singing the super high notes, the tongue should slightly turn back and shouldn't stay forward and down, and it should turn back and high, because the reason behind that they've mentioned a lot, especially in Arturo Melocchi's school, in order to lower the larynx, low larynx method, they believe that the tongue's root is connected with the larynx. That's why to relax the larynx more, the tongue should slightly turn back and high. How do you explain this, and what's your opinion about these big singers of the past? They explained that.
Yeah, so Sharam, this is very important. And I think, okay, so what you're describing, I know Birgit Nilsson's pedagogy quite intimately. So I want to speak to that a little bit. The Melocchi school is definitely, in my opinion, not leading singers down the right track. And also, in my opinion, is a technique that was developed, I think, to provide compensations, which we're going to talk more about tomorrow. Birgit Nilsson, I think if I understand your question, you were saying that she and Kalas and we're saying that the tongue raises like in the back, and that is absolutely correct. That's and I do observe Nilsson, which now here's the thing that you guys have to realize, and we're going to talk way more about this tomorrow, but everybody is different, okay? Everybody is shaped differently. There's different things. And so, you know, I noticed in the chat, people were saying 75% of people have some sort of tie. So then why isn't this normal? Well, I don't think we're saying it's not normal. I think we're saying it's not functional for singing. So I think what you're asking is that there are techniques that provide assistance for when you can't do other things. But what we're looking at is developing in the direction of the correct technique, which is that the tongue stays relatively high in the back for top tones. It doesn't pull, you're not yanking your larynx, but it does stay relaxed and high. And techniques that encourage the opposite are probably not going to be helpful long-term for your vocal longevity. So I don't know if that answered your question about the Melocchi school, specifically, Sharam. Did that answer
Thank you so much. Yes, I do think so. The only thing that I think it missed just quickly because of the time matters, they all believe that the tongue should slightly turn back. It lets the larynx moves down automatically and with the breath power, not with the Leon muscles. That was all. Thank you.
Okay, thank you.
Thank you so much.
Robbie, do you want to jump on and?
Sure. I was actually about to ask literally the exact same thing. You know, I was just listening to this past thing, and I'm sure I look annoying because my profile picture includes Maria Callas in it. So, you know, there are like all these other singers that were not connected in any way to Melocchi, who also had the same kind of tongue thing. It's not necessarily the back, it's just like that the tip is not touching the bottom teeth, and like the entire unit is just kind of pulled back. And so I was going to ask, you know, what you think about that. And there's an entire generation of singers, and you can look at videos of any of them and they all kind of do the same thing. It doesn't matter if they're what pedagogical background they really had.
Yeah.
I want to say something to that real quickly. I see a lot of people talking about teeth in the chat and like where your tongue should be positioned with your teeth. I just want to clarify that, again, all of these things are interconnected, right? So you can't judge your tongue based on where your teeth are, because your teeth could be in the wrong part, right? If you have an upper arch that's this wide, you're going to have tongue issues. And we can't say, oh, your E vowel should have the sides of your tongue within your molars, because your molars aren't in the right spot, right? So what we're talking about here is we're talking about function. We're not talking necessarily about structure. And, you know, just because, you know, a large portion of the human population is nearsighted, like me, that doesn't mean that it is normal, but it's not functionally ideal, right? So the whole point of this is that we're not saying, oh my gosh, there's so many things wrong with you. You were born like an alien monster. No, what we're saying is that, okay, you're not functioning at the correct human anatomical baseline. And so therefore, you're going to have issues in how you move, how you function, and how much strength you have. Also, in regards to the pulling the tongue back, there's always going to be a lot of discrepancy on tongue position in singing. So, I mean, I haven't tried them all, so I can't say that, you know, which ones work and which ones don't. But I want to clarify that you should be able to lift the back of your tongue while keeping the larynx down and not having it pull backwards. So there's a lot of people that cannot do that. And so, you know, we can't raise, you know, Pavarotti from the dead and ask him, but, you know, it is something to keep in mind that technique should be something that you choose consciously. You shouldn't have to pick your tongue position based on what you can and can't do. You should be able to do everything. And then from there, you choose what works best to create the best sound, not creating a sound based off of what your current ability is. I hope that that answers a lot of questions for anyone.
Just a slight addition to the question, I guess. For the NG sound, you should be able to touch, so it goes up in the back and you simultaneously touch the tip to the bottom teeth.
Yes.
Okay, because yeah, I can do okay.
Right? You may even be able to extend it below your below your bottom teeth and make an NG. All right.
Okay. Yeah.
I hope that clarifies that for everyone.
Yeah, I think that's a really good point, Jessica, that you're making about where, however, where I come from as a voice technician, I actually do have opinions on where the tongue should be. But if you are experimenting and you're doing, you know, this style of music, or you do have a different technique that works for you, you need to assess, like, are you doing it because you can't do the other thing? Or are you doing this because it's your choice? I think that that's a great point that you just made, Jessica. So thank you. Okay, I would love to, I know we have a ton of questions. We still have tomorrow, so don't worry, because a lot of these questions are going to be answered again. And I think we can probably, I'm going to be saving this chat, so I will make sure we address a lot of those questions as well. I want to quickly just give you a heads up about something we're going to talk about tomorrow, before I invite Leah to come on and share with you a little bit about her journey. Leah, are you here? Are you in the house now? I think she is. I think she is.
I'm here.
Oh, you're here. Perfect. Okay, good. Fantastic. So I'm just going to quickly tell you about something that I will talk about a little bit more tomorrow, but we are offering Jessica, myself, Leah, Bryce, who you'll meet tomorrow. We have Chris Kelly of the Musical Athlete, and also Jenny Clift of A Better Life Tapping. All of us have developed a program called the Myofunctional Singer, and this is a 3-month exclusive group program for singers seeking to revolutionize their technique through myofunctional strengthening and integration. And it is for a singer who has or suspects they may have a restriction, as well as singers who are looking to up-level their technique and really gain control of what's happening in here. So I'll tell you a little bit more about the program tomorrow, but I'm going to be posting links right here for you to read more about the program and to book a discovery call to see if you might be a good fit. And then we can talk a little bit if we suspect that there's a restriction. We also offer an inclusive package that can take you, if you are considering this journey to have a tongue or lip tie release, this would take you inclusively through your myofunctional training. Through the procedure, we'd find a provider for you. We haven't talked about this, but I want Jessica to speak to the importance of finding the right provider. This is not as simple as going out and getting your tongue cut by anybody that says that they do a frenectomy. It's really not quite that simple. So we would take you through that whole process, and in addition, we would be doing vocal work. So there's technique sessions, there's workshops. So we're integrating as a singer, not just myofunctional therapy by itself, surgery by itself, and then voice lessons. We're taking all of those things and putting them together to help you through your journey. So I will tell you a little bit more about this program tomorrow, but if this sounds like something that you want to do, if you book a call with me in the next 2 days of the symposium, then I'm going to offer an additional bonus session with myself if you choose to do the program. So I think Julia's put some links for you to check that out. So that would, I will look forward to telling you a little bit more about that tomorrow. Okay, so now I would love to invite Leah on. And actually, Jessica, no, I did say I wanted you to talk quickly about, let's do our little cautionary tale about finding the right provider first. Let's do that.
Sure. Basically, you all know a lot more about tongue ties than even some of the dentists in the field currently know just after this 1 hour. So I want to stress that airway focused dentistry is really new on the scene. There's not a lot, as in like a large quantity of studies, but there are some really fabulous ones that you can find on my website of published medical studies. If you're really into that and you want to look at actual numbers, you can find those there. But this is very new on the scene. And so basically, you really want to make sure that you're finding somebody who has done this a lot, has had some that maybe weren't so easy so that they knew how to handle it. And you also want to find a release provider who sends you to myofunctional therapy before and after. Because if you just go in and you cut it and then you keep going back to all of your bad posture stuff, you're not fixing anything. And in fact, it can actually grow back worse. So you want to make sure, and especially because we're singers, you know, you don't want somebody who's half good. You want to go right to the top. So there's not a lot of options when you start looking for really great people. And a lot of us feel a lot of stress with knowing what to look for and who to go to. And I don't know how to believe if I think that they're good enough or not. So we all decided that we were going to take that stress off of you. So if you sign up for our program, we're going to go through and I will personally find you all a top-notch release provider that is nearby. Depending on where you are, you know, Eastern Europe, you might have to go to a different city because there's not very many. But we want to make sure that you guys are getting the absolute best care, and we want to help you do that. So in my opinion, that's probably one of the biggest draws of this entire course with us, is that you get to work with not only one expert, but you get to work with all of us. And we're going to help shepherd you through this entire process because we know how stressful it is. And we want to make sure that we can guarantee you an absolutely fantastic result and that it will last your entire life.
Awesome. Thank you for sharing that, Jessica. That's so fantastic. Okay, so now, last but certainly not least, we had a change in plan for those of us joining a little bit later. Leah was supposed to speak earlier, but we had some tech difficulties. So Leah is going to come back on and she's going to share her journey, which is so inspiring, and can't wait for you to meet her. So Leah, take the stage.
Hi, everyone. I hope it's working better now. Everything good? Great.
Perfect.
Thank you. Thank you so much for your patience. And thank you, Julia, for this opportunity. Today is a dream come true for me. It's a dream come true to be able to speak about answers, solutions around some of the things that I have dealt with as a singer for more than 20 years. And that I know other singers deal with too. So just kind of the abridged version of my vocal history. I have always wanted to be a singer. In fact, I was one of those people that another career path never even occurred to me. I've always loved to sing and felt so drawn to this field of performance specifically. And so I started studying voice very seriously around the age of about 15, and then went on to major in it in college. I have 3 degrees, 2 masters in voice performance, and about 10 years of teaching experience. So there are 2 things that I would say characterize my vocal journey. The first one is desire. I just had such an intense desire to learn to sing, to understand my vocal instrument, to master it, and to learn about this field. And the second thing that has characterized it is struggle and resistance. So I learned very quickly upon getting into the university setting that even though I was working as hard as singers around me, I was not experiencing the same type of growth. I was not experiencing the same type of forward progress in my vocal growth and in my vocal technique. And some things I started hearing things. I started hearing kind of a repeated set of vocal criticisms that would become for me the soundtrack of lessons and coachings and auditions over the next about 15 years. And so maybe you relate to some of these, but I heard a lot of things about inconsistent vibrato. I heard constantly about my inability to isolate the movement of the jaw from the movement of the tongue. I heard constantly issues about my inability to correctly pronounce certain vowels. I referred to some of these. For me, it was virtually impossible to pronounce a correct, pure oo vowel with any degree of freedom whatsoever. In fact, I actually don't produce a pure oo vowel until I had my release done, but difficulty pronouncing and sustaining correct vowels. Certain consonants would trip me up. In fact, it would be such a laborious effort to pronounce those consonants that it would break an entire line. And so there was, in terms of just basic pronunciation and correct articulation, there was so much effort in my singing. I had constant comments about the fact that when I sang, that my mouth was in this position all the time, almost always, and it would become even more pronounced as I would ascend, particularly up through the passaggio. So, and this was always, of course, a complaint because I was a classical singer, I was an opera singer, and that spread sound was not conducive to the type of tone that we were trying to produce. And it also did not serve the type of relaxation and freedom that I wanted. I had, of course, tremendous issues with this pendulum of, if the tongue was relaxed, what felt to me like relaxed in the mouth, the pendulum would swing and I would get comments about, there are no overtones, where's the ping? That's a swallowed sound. The larynx sounds like it's depressed. That sounds like tongue tension to me. And then if I would adjust my tongue position to try and create clearer, purer sounds, my voice would fatigue very quickly. I would feel a lot of pressure in the larynx itself. And I would get comments about just that there was stress in the sound of the voice. Top notes were incredibly difficult. In fact, I sang as a mezzo through my first master's, and then didn't even get into soprano repertoire until my second master's. It was one of the reasons for my second master's, but had enormous difficulty accessing the very top of the voice, even though it was clear I was not a mezzo. And just comments about it's too wide, it's too open, it's too metallic. And even though I grew vocally in many areas as I walked this journey, and things like breath improved, and consistency and musicality and that sort of a thing, even though I got roles and got into great programs and had great opportunities, there was a level of, how can I say this? There was a level of my singing that felt totally unorganic. It felt like I had to force my voice to do every little thing. Things in my singing, new technique, never became second nature. In fact, it just felt like as I learned and grew, I added more balls that I had to juggle, and I had to constantly be thinking. Julia gave the analogy of singing was like walking a tightrope. And I would say that that is exactly what it was like for me. Singing was walking a tightrope, and like people were trying to add things on top of what I was doing as I was walking that tightrope. And it was discouraging. I don't know how else to say it. It was, I'm thankful to have been given by God, I think, such a deep desire to explore my voice, that my desire for that was always greater than the sense of discouragement and the struggle. But I did come to a point a couple of years ago where I had absolutely exhausted all my options. I had read Nat's articles, and I had worked with this teacher and that teacher, and I had read all the vocal pedagogy books. I taught vocal pedagogy. I had no idea where to turn. I felt like I had exhausted all of my options. And last year, I went to a routine dental visit to have dental cleaning done. And a dental hygienist told me that the reason I had a problem with chronic teeth grinding at night was because I was tongue-tied and lip-tied. And that blew my mind. You know, Julia asked you at the beginning, where does your tongue sit at rest? And the dental hygienist asked me that. And I said, oh, well, on the floor of my mouth, of course. Like in my mind, like everybody else in the world. And she said, oh, but that's dysfunction. The tongue is designed to rest on the hard palate. And I'm so thankful for all those years of obsession with technique and trying to learn about the optimal function of the vocal mechanism, because the minute I learned that I had a very severe posterior tie and lip tie, the dots started connecting for me. And so then that set me down the rabbit hole of trying to find out who's talking about this. Where are the presentations about this? Where are the footnotes in the vocal pedagogy textbooks, where there has to be information out there about this? And I found almost none, except for some conversations between singers who had gone through this process and were wondering if it would impact their voice. And so I learned everything that I could. And at the end of last year, after going through about 10 weeks, actually, for me, of myofunctional therapy, I went and saw a brilliant dentist who specializes in release procedure. He actually wrote a book called Tongue Tied, Richard Baxter in Alabama, and he released my tongue tie. And can I say that there is work to be done after the tongue tie is released in the singing realm? Okay, there is retraining. I have had years of compensatory muscle memory that needs to be retrained, but I finally understand the freedom that is possible. I finally feel that when I begin to sing, I am starting from the right place. I'm starting from square one rather than -4 or 5 because I had this restriction. And singing was always a compromise. It was always a compromise. It was always what I developed was a working technique that allowed me to accomplish what was most important in my singing, but without the ultimate freedom that I felt in my spirit, in my instinct, I should have. And I think a lot of us feel that as we are incredibly attuned as singers to our minds and our bodies, and we sense that there is a deeper level of freedom that is available to us, but we don't know how to get to it. So this is a passion project for me. To speak around this, to have the opportunity to be a part of this, is a passion project for me, because after 20 plus years of discouragement and struggle, I think there are finally ears for a lot of singers in the vocal community who have unbelievable potential. If we can provide resources for them to have the freedom that really their bodies are designed to have and the voice is designed to work with. So anyway, that's a little bit of my story. I'm just so grateful to be a part of today, and what Julia is doing through her platform. So just thank you for joining us today. I'm so grateful.
Thank you so much, Leah. Yeah, and you're going to hear more from Leah and I tomorrow, because we're going to really dissect a lot of the sound components. We're going to do some listening examples, and you're really going to get a picture of the various ways that this manifests, because I think the journey can look slightly different for every person. There certainly are some hallmarks, but I will tell you, as you'll hear tomorrow, in my case, I think anyone that had heard me before would not have known I was tongue-tied, especially when I kind of rehabilitated myself. So there are, I think, when you're listening to today and tomorrow, I want you to just really keep an open mind and don't assume that your vocal problems are your fault. Like, just let that little door open in your mind and just say, what if this is not my fault? What if this is something that I'm just is a structural difference in my body? And what if there was something I could do about it? So I want to kind of end on that positive note, but we're going to end our presentation, but we still have a few minutes left for questions, which I see so many questions. So if you would prefer, you can raise your hand. That might be a little bit easier, so we don't have to scroll through the chat and your question doesn't get lost. And yeah, we look forward to hearing your questions. Okay, I'm looking. Nobody has questions? I'm really surprised. I don't think that's true. Hold on, let me look. Okay. Cecilia says, are you going to address the importance of checking the size of the maxilla before getting the tongue tie release to avoid getting the problem with the size of the tongue? Yeah, you know, Cecilia, also, like, just keep in mind that none of us actually do the surgery. So the surgeon will actually assess all of those like nitty gritty components. And unfortunately, yes, there are cases where it is kind of not possible to get a full release at the same time. But Jessica, I think let's have you come in and talk about that a little bit.
Yeah, so we didn't have time to talk about the importance of shape and structure today. I wanted to focus on function because that's the biggest thing for us singers. But like we talked about, it's not one or the other, right? It's a two-way street. If you have good function, you're going to have good structure. If you don't have good structure, you're not going to have good function, right? So there is a little bit of this like give and take in this working relationship. So yeah, we can't always release your frenum before we fix some of those structural issues. Usually we can. I would say about 90% of people, no, 97% of people that I see personally, we don't have to do any like orthodontic structural changes beforehand. But yes, sometimes we do have to approach it from that side of the equation first. Thank you for that question. That's fabulous. I'm going to answer Sarah's question about doing myofunctional therapy for singing before getting the frenectomy to try to eliminate compensation. That's such a great question because there's two different kinds of compensation, right? There's compensation that's caused from not having strength to isolate. And then there's also compensation that happens because you are anatomically unable to isolate, right? So that's what we're trying to get at here with this whole tongue tie thing, is that if you have certain kinds of tongue tie, it doesn't matter how many times you go to the gym for your tongue, you're not going to be able to function fully, right? So you obviously get a lot more strength and isolation ability available to you if you are fully free. So that's why we all need myofunctional therapy both before and after, because we have to set you up and get you in the best spot possible for a release. Then we get your release done. And then we have to retrain all of that new freedom and that new movement that you have. I use this metaphor all the time. Let's imagine that you go to the gym for your bicep, right? But you have a bicep tie. So you go like this, right? You're still going to increase your bicep strength, but you're not going to get very much out of it. So if we cut your bicep tie, now you have this entire range of motion, but guess what? You're totally weak because you're increasing it by 75%. So now we have to go back to the gym and we have to work through that entire range of motion so that you're now using your new structure and ability to its full potential and creating really fantastic, correct function. Love that question. Thank you. I don't see any more questions.
Anybody have a question? Go ahead and raise your hand. If you don't want to come on, you can type it in the chat too. I did see something way back that I don't think we addressed that was important. I'm trying to look through the chat too.
Oh, someone mentioned something really important. I wanted to, I answered in the chat, but I want to say it out loud.
Mm-hmm.
Yes, you do need a frenectomy to correct the tongue tie. They do not stretch. They're not
Mm-hmm.
like muscles. They're tendons and tissues. So we cannot do this like holistic thing where we just stretch it out of you. We have to actually go in and remove it.
Yes. And, you know, I do want to just speak, we're going to say this tomorrow as well, but I also don't want this to feel, anybody who's sitting there and is like, damn it, I have a tongue tie, like, oh my God, what do I do? Like, maybe you're a professional singer, maybe you're working right now. Like, don't feel for a second that you can't sing, okay? I was a professional singer. I was doing very well, okay? And I had a tongue tie for all these years and I didn't know it. Now, I ran into some difficulty and I do believe that it was because of my tie. And I also believe that had I continued, even though I did resolve that, had I continued on the path, I may have run into an earlier demise of my instrument than maybe I, should have. So I do think that there are compensations that we do. I mean, everybody does compensations, whether you have a tie or not. I mean, this is just the nature. No one is perfect, right? Like, we all are human bodies and they work in different ways. So don't get discouraged, but also know that if this is what you want, if you really want to sing with freedom and ease, there are options out there for you. And I really do stress, if any of you are out there and you are professional singers or you are on the journey to become a professional singer, this should be at the top of your list. This is non-negotiable. This should be looked at right away, especially if you're starting your journey. There's no reason to have to do this uphill battle that so many of us have already fought for you. So let us do the work for you and just learn from this experience. I also just want to say, because we addressed this a little bit, but I do know this from my own experience, and I think Jessica will hop on and tag team on this, and Leah as well. in terms of posterior ties, there are a lot, there's a lot of discrepancy out there. So if you go and Google this on the internet, you will find people saying, oh, that's not a thing. Okay, you can go on Reddit. Yeah, but if you use your brain and you look at the tongue and you look at the larynx and you look at where the tongue attaches onto the hyoid bone and you understand how the function relates, you will understand in your head that having a restriction is just not good, right? It's not good. And the restrictions are real. They are actual things that it's not a fata morgana, right? It is a thing. So it is very important in finding these providers that there is a wonderful surgeon named Dr. Zaghi, and he has personally trained many surgeons around the world in this, what we call a functional frenectomy. And a functional frenectomy is very different than just a regular old frenectomy. And the functional frenectomy will assess when you're getting it done whether or not your range of motion was increased. In the case of myself, my fascial tie, okay, if you understand the fascial tie was released. But my provider who trained with Dr. Zaghi decided, you know what? That's not enough release for her. And so she cut into my genioglossus muscle and gave me a full release. And this is the kind of provider that you're going to want. So when we say that we're here for you and looking for these right providers, like that's what we're talking about. Jessica, I'd love you to maybe hop on and say something about that.
Yeah, I was just about to type in the chat. We only want the best for all of you. So we're not going to put up with someone who's like, oh yeah, I've done like a couple of lip ties. Like, no, I want to see their cases. I want to know what kind of laser they have because they're not all the same. I want to know what their protocols are for how many weeks of myofunctional therapy before you even walk into their office, right? As we all know, in any career, people can know a fair amount about one subject, but that doesn't make them an expert. You want somebody who is an expert, who has tons of experience, who sees you and goes, yes, I know exactly what that is. I'm going to take really great care of you. That's what we want. And so we're going to help you by taking that weight off of your shoulders so that we can ensure that you're already going to have a really fabulous release, no matter who you are or where you are.
Awesome. I think Amy just asked a quick question about, is there a list of people around the country who may be ideal surgeons?
Yes, so Julia just mentioned Dr. Zaghi, Z-A-G-H-I. He runs the Breathe Institute. He is also the #1 leading researcher on tongue ties. Most of his ankyloglossia publications are from him. He's been a fellow at Stanford, Harvard. He's the real deal. He runs a page called Breathe Ambassadors, where he lists by location all of his tongue tie frenectomy providers who have taken his expert sleep course. I recommend you start there. There are others. I'm a little biased to Zaghi, but there are lists if you know who to ask and where to look. But again, we're trying to eliminate your workload. We're trying to take some of that from you so that you can focus on your posture and your exercise and sort of, give everyone a better idea of their focus.
Yeah, and with the lists too, I know in my case, my myofunctional therapist, she was calling around. I live in Bratislava. I didn't say that at the beginning, but I actually live in Europe with my husband. And so I was researching getting a release, and I said, well, there's nobody around here, right? So my family's from Florida. So when I went home over the holidays, I actually got my release done in Tampa, Florida. I think Celeste and I both have the same doctor, Dr. D in Tampa, and she was trained under Zaghi, but my myofunctional therapist was very insistent that she called, like she was asking certain questions. So there's a list, but that doesn't mean you just kind of pick from the list. Like, there are certain things that your myofunctional therapist will want to know. Okay, so guys, we have a full day tomorrow, and I am just so excited that you all have joined us here today, and we look forward to seeing you all tomorrow. Replays will be sent out this evening once this recording is done initializing and everything. And I just want to thank so much Jessica for her fantastic presentation. And we're so happy to have her here, and for Leah and sharing her story. And you're going to hear a lot more from Leah tomorrow. So thank you so much. It's been a pleasure. All right. I'm going to go ahead and save this chat too. Bye, everyone. Thank you. All right. I'm going to stop the recording here.